Government conducts in-depth assessment for enhanced connectivity in Region 8 and 9 villages. The government of Guyana is set to significantly improve the livelihoods of hinterland residents through a comprehensive upgrade of the road network and infrastructure from Monkey Mountain in Region 8, Potaro Siparuni, to Carasabai in Region 9, Upper Taku to Upper Essequibo. The planned enhancements will also extend to the interlinks and bridges connecting villages such as Tusning, Bamboo Creek, Bashville/Yong, Paramakatoy, Kato, Kurukaberu, Kamana, and Kapanang in Region 8. This initiative was announced by the Minister of Public Works, Bishop Juan Edgehill, following an in-depth assessment and consultation with village councils. Minister Edgehill, along with the Minister of Amerindian Affairs, Pauline Sukhai, and a team of engineers, spent 3 days engaging with local communities. The assessment was conducted under the directive of Vice President Dr. Barrett Jagdeo, who mandated that the ministers engage with locals to identify the most effective methods and costs for road improvements. We don't want to assume anything. We would like to hear from you. What is the best method of getting the road improved? And what is the best approach that we can take? Minister Edgehill stated during the consultations. Despite the awarding of small community participation contracts to maintain the roads, Minister Edgehill emphasized that the government recognizes the need for more extensive efforts. The initial phase of the project focuses on improving the corridor from Carasabai to Monkey Mountain, aiming to establish a better road link between Region 9 and Region 8. Just putting in that road significantly improves your standard of living and reduces the cost of living, Minister Edgehill explained to indigenous leaders. In addition to road improvements, the initiative will empower residents to undertake necessary work, creating employment prospects within the communities. Minister Edgehill noted that discussions will be facilitated with other ministries to provide locals with training in operating heavy-duty equipment, allowing them to participate in non-manual labor tasks. Residents will continue to benefit from maintenance contracts alongside the new projects planned for the region. Minister Sukhai reiterated the government's strong commitment to hinterland development for the benefit of its people. Our government will continuously be willing to work. It's our responsibility to advance and increase the level of advanced services, and we're working on it, she stated. Discussions on this major improvement program will be further advanced at the upcoming National Tashayos Conference, NTC, 2024, scheduled for August 19th to 23rd, where over 200 leaders will convene for a week-long engagement with the President and his cabinet ministers. Improved connectivity is expected to stimulate development and economic activities, leading to increased opportunities, enhanced health and well-being, and a significant reduction in the cost of living for the villages. During the assessment, the ministers also addressed residents' concerns in areas of health, education, and agriculture, pledging to collaborate with relevant ministries to resolve these issues. Major investments by the Ministry of Local Government and Regional Development enhance Guyana's communities. Georgetown, date. The Ministry of Local Government and Regional Development has been making significant strides to revitalize and enhance local neighborhoods through substantial investments in infrastructure, community engagement, and sustainable development. Since August 2, 2023, billions of dollars have been allocated to Neighborhood Democratic Councils, NDCs, Regional Democratic Councils, RDCs, and municipalities, vastly improving services for residents. Rejuvenating communities. Residents of Cane Grove, East Coast Demerara, now benefit from the $14.2 million NDC office commissioned last September. The two-story building includes 3 offices, 2 waiting areas, a boardroom, 3 washroom areas, and a storage room. The NDCs utilize collected rates and taxes to support local residents. In Region 1, a $44.1 million farm-to-market road was opened in Arakamai, reducing travel time to less than an hour. The 10-kilometer gravel road benefits students, farmers, and loggers, connecting Arakamai to villages like Wana, Kamwata, and Whitewater to the Kamaka market. Additionally, Canal Bank in Region 1 received a $3.5 million engine and boat to improve school attendance. Matthews Ridge saw the construction of a $31.8 million bridge, enhancing economic development, connectivity, and business cooperation with nearby villages such as Baramata, Black Banana, and Tasawini. The National Pathway Workers Program received a $10 billion boost for 2024, providing unemployed Guyanese with the opportunity to work 10 days a month for a salary of $40,000. Local government organs were allocated $1 billion in January 2024 to fund various projects, including village cleanliness and small rehabilitation projects for roads and recreational facilities. Addressing solid waste. In 2024, $2.6 billion was allocated to solid waste management. This included $1.3 billion for landfill site development and cleanup programs. The Hogsbosch Sanitary Landfill site received $572.6 million for upgrades and completion of a semi-aerobic cell to increase capacity. New waste management equipment, including tire shredders and air quality testing tools, were purchased for $92 million. Additional dump sites in Laguan, Mabaruma, Santa Rosa, Wakenam, and Yupakari will also be upgraded. Upgrading municipal markets. Several major markets have been upgraded to enhance vending and shopping experiences. The Charity Market in Region 2 is undergoing major rehabilitation following a $286 million contract signed last November. The new section, expected to be completed this year, will feature a steel-framed structure providing improved space and accessibility for vendors. Other markets undergoing construction include Hydrony, Leonora, Purika, and Mon Repos, with $1.2 million allocated this year. Rehabilitation works on the Corriverton Market commenced in March, costing $43 million, with additional works planned for Kamaka and Suddy markets. Providing safe spaces. The government is committed to creating safe and family-oriented communities through the establishment of green spaces and recreational facilities. The Mabaruma settlement's 5,000 residents benefit from a $3.5 million community center, while Caracas in West Canj Burbis now has a $6.4 million recreational facility for various leisure activities, a collaboration between the government and the government of China. Supporting education. A new $25.7 million education office in Oronok, Port Kaituma, serves as a central hub to bolster quality education delivery within the Matarkai sub-district. The facility accommodates education officers, schools welfare officers, staff from the Cyril Potter College of Education, CPCE, and other Department of Education support staff. Guyana's health sector achieves remarkable milestones over the past year. Guyana's health sector has seen unprecedented growth over the past year, thanks to the relentless efforts of the government to establish a world-class healthcare system. Since August 2, 2023, several significant advancements have been made, positioning Guyana as a leader in regional healthcare. Among these achievements, Guyana has become the first country to implement a joint program on mental health and psychosocial well-being and development of children and adolescents. Additionally, Guyana is the first Caribbean nation to offer a Bachelor of Science degree in respiratory care, now part of the University of Guyana's curriculum. A $97 million digital X-ray unit was commissioned at Fort Wellington, Region 5, broadening healthcare services and enhancing diagnostic capabilities. Advancements in medical services. Life-saving kidney transplants are now accessible to countless Guyanese, following the Georgetown Public Hospital Corporation, GPHC, being certified as a kidney transplant center. This certification marks a significant advancement in the nation's medical capabilities, improving citizens' quality of life and fostering a healthier future. Hundreds of Guyanese are receiving financial support for eye care through the government's eye testing and spectacles program. Individuals under 18 and over 65 years old receive a $2,000 voucher for an eye test and a $15,000 voucher for spectacles if needed. Additionally, women aged 21 to 65 benefit from the cervical cancer screening program, which provides an $8,000 voucher for screening and follow-up care. The government also launched the National Action Plan for the Elimination of Cervical Cancer for 2024 to 2030, aiming to reduce the mortality, morbidity, and disability caused by cervical cancer. Nearly 20,000 nursery children have benefited from medical screenings under the Child and Youth Health Program, CYHP, which focuses on oral health, hearing, and vision. Efforts to address mental health and suicide issues have advanced with the launch of the new National Mental Health Action Plan and National Suicide Prevention Plan, both comprising new programs and policies implemented from 2024 to 2030. Modernizing infrastructure and equipment. The new $120 million health center in Diamond is providing improved services to 40,000 residents in the area. Health services have also expanded in East Canj, Burbis, with a new $3 million dental clinic at the Cumberland Health Center and a $56 million health center in Canefield. Mahayakoni Hospital now features a retrofitted X-ray department and a high-tech X-ray machine valued at $30 million and $49 million, respectively. Hospitals in Mibikuri, Port Morant, and New Amsterdam in Region 6 have also received state-of-the-art X-ray machines totaling $184 million. A new $14 million health post was commissioned in Kiko Village, Region 9, and ultrasound services are now available in Anai, Carasabai, Aishelton, and Sand Creek. Additionally, The Ministry of Health and the Guyana Police Force received 300 sexual assault evidence collection kits valued at $3.7 million to support justice for women in Amerindian communities. Ground was recently broken for the modern $161 million new Amsterdam hospital, which will feature 5 operating theaters, advanced digital X-ray and CT scan machines, an MRI machine, and facilities for cardiac surgery and transplants. The compound will also include a teaching facility and a modern psychiatric facility. 6 new regional hospitals are under construction in Anna Regina, Region 2, De Kinderen, Region 3, Diamond and Enmore, Region 4, Bath, Region 5, and Skeldon, Region 6, with work progressing steadily. Innovations in training and education. 29 young people from Region 9 have graduated from the pharmacy assistant course and have been deployed to various health. 40 houses under construction at 5 Miles Housing Scheme, progress update. The government is currently constructing 40 turnkey houses at the 5 Miles Housing Scheme Phase 2 in Region 7, with completion anticipated by the end of September. This announcement was made by Minister of Housing and Water, Colin Crowell, during a recent interview with the Department of Public Information, DPI. A section of the 5 Miles Housing Scheme Phase 2 in Bartica, Region 7, is part of the government's accelerated turnkey housing initiative aimed at providing affordable housing solutions to Guyanese across the country. Bartica, as Minister Crowell indicated, is no exception. The 40 houses are 15% complete, and by the end of September, we expect them to be completed. These are 3-bedroom, flat houses, and construction is progressing quickly. We have invested approximately $495 million in this area for these houses, Minister Crowell stated. He continued, the turnkey initiative allows individuals to pre-qualify for the houses and pay for them through the bank. In addition to the construction of these houses, the ministry has allocated house lots to around 150 LADs. This 99-acre housing scheme yields over 300 serviced lots, located near the Bartica airstrip. It will feature residential and commercial lots, a community service center, and recreational spaces. The government is subsidizing the housing scheme to ensure LADs have access to necessary amenities. Over $1 billion is being invested in infrastructure works, including drainage and road networks. According to Minister Crowell, the infrastructure work is about 80% complete. The housing scheme will be directly connected to the Bartica/Potaro Road and the incoming Araway-Tepera Road, enhancing road access and opportunities for residents, miners, and commuters.